Today on the show, empowering patients to schedule their own appointments with cancer specialists. Welcome back to Cancer Buzz, where we cover the latest in cancer care. I'm your host, Summer Johnson. Today's guest is disrupting the way patient scheduling is done to give patients more control. Laurel Bray-Hanin is the Vice President and Chief Operating Officer of Cancer Services at UC San Francisco Health.
So the traditional models for a patient who is diagnosed with cancer or who is seeking a second opinion is typically that a referral will need to be sent from whoever is their current physician, maybe a primary care doctor. And likely the patient's told, you'll get a call and then you'll get scheduled. And patients have a lot of anxiety and trepidation, not knowing what's going to happen and do they have a lethal disease. And so we wanted to empower patients to be able to simply go online and self-schedule. We know that more and more people are leaning in towards self-management of things like shopping and groceries, all these types of things. So we thought it's time to really look at the healthcare space and how do we try and match that access issue.
What have you learned from patient self-scheduling?
Almost 50% of the patients who used our online self-scheduling did so outside of traditional business hours. And that tells me that there are patients, in evenings and weekends, and that's the time when they're able to maybe deal with their medical care and deal with scheduling. Perhaps they're working during the day or have children or other commitments. And I think that's pretty striking because typically our call centers and staff who might respond to messages, they're not there at those hours. And so I think that something really critical for us to think about as we move forward.
Did you have any unexpected outcomes implementing this?
So we had a lot of pushback, as you might imagine. A lot of our stakeholders felt that patients would not be capable of accurately self-scheduling. And so an unexpected outcome was that is not true. We were able to design simplified decision trees for patients to help them have high accuracy, selecting the right practice and provider to be seen in.
What advice do you have for a community cancer practice interested in developing a patient self-scheduling tool?
My advice would be to think about your current capacity. And if you have a lot of access and lots of openings on physician schedules, that you could implement this model for patients to self-schedule directly with a physician. But if that were not the case, you could implement our other model, which is patients self-schedule an intake appointment with a navigator. So in both situations, patients are able to schedule their next step and can do it at a date and time that's going to work for them.
What do you hope is the main takeaway for your article?
I think one of the key messages is that it's time to really disrupt and change what we've always thought to be the best way to take care of patients, especially cancer patients. And that we have high satisfaction, patients being able to self-schedule and know that they're moving forward with their medical journey.
Thank you, Laurel. If you want to learn more about how this cancer program improved the patient experience and increased patient volumes, you can read the article, The Evolution of Patient Empowerment, Self-Scheduling New Patient Consultations, in the most recent Oncology Issues. You can find that in your email inbox from ACCC. Thank you for listening. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.